everyone's overall well-being. So I kind of wanted to put that first and foremost before we got started. I don't know if you wanted to add to that, but started speaking upon that. You got.
No. So I think Sierra's right. I think, with the times that are going on right now, we just want to make sure that everyone's getting really solid science-backed information and stuff that you can go on to make good decisions, good solid decisions. Because there's a lot of information out there. There's information overload out there, and there's misinformation overload out there too. So you have to be careful. So we're here to be a source of informed information. Informed and amazed. We're just trying
I
to
think we
be
know where we're going.
fair enough. We're trying to help you make informed decisions about the choices you make.
Yeah, I think that's really important. Okay, so let's jump right into it. While we're talking about of severity and kind of understanding exactly what in Europe is going on right now, what in California specifically, nationwide, what are you seeing in hospital, in practice, in office on a daily basis?
Well, the spikes that we were initially intended, all the initial plots, all the initial guidelines, all the initial curves that we were expecting haven't really appeared. And I don't know if that's because of social distancing and it worked early on, or if it's because the weather's gotten warmer and the virus may not be as active in the weather, in warmer weather. We don't know, is essentially what's going on. But what I can tell you is that people are still getting sick, people are still getting affected. It's just not at the numbers or the volume that we anticipated. And we're not sure if that's to do with, the efforts of social distancing or not. So I know that a lot of states are starting to relax their social distancing standards. And we just want to make sure that everyone does that cautiously and safely.
Yeah, I think that also speaks to the California demographic, but I know that you've had experience with family members elsewhere in other parts of the country that have had a different experience with this whole process.
Yeah, there's a rush. There's a rush to get back open. You can see it with the protests in Ohio. They can see it with the protests in Michigan. And I think a lot of times people rush because it's not really affecting them personally. If you've never been personally affected with this, if it doesn't hit close to home, then it's hard to understand why this is necessary. It's hit close to home in a couple of different ways. Last week, one of my great uncles passed away and died from coronavirus. He was sick, he had diabetes, he was overweight. He went to the ICU about a week and a half ago, and he was put on a ventilator a few days later, and he passed away last Thursday. It was really, really difficult for the family. I mean, you can't go see him in the hospital.
Yeah.
You can't be there with them when they pass away. It's a really devastating kind of thing. By trade, I'm a urologist. I see that question just pop up. But it doesn't hit home. And then earlier this week, on Monday, I was on call, and I got asked to go see two patients, one with kidney stones and one with blood in the urine, and they were both COVID positive. And as you're walking onto these floors with these COVID positive patients, and you're getting ready to walk in this room, and you're putting on goggles, and you're putting on gloves, and you're putting on your N95 mask, and you're putting on this gown, and you are looking at this room, and you're telling yourself, okay, I'm about to expose myself to something that makes this person really sick. And how do I feel about that? Well, if you've never, put yourself in that situation, it's really easy to say, let's open everything back up, because you're not putting yourself at risk. You're not knowingly putting yourself at risk or exposure. But, getting ready to walk in that room, it was a real kind of come to Jesus moment with myself. I'm like, well, I got to do what I got to do, and I'm taking all the precautions I have to take. But it was still a little bit of a scary scenario just walking in there. But I feel fine right now, so hopefully it all worked out well.
Yeah, I think that's huge. I think that's where, you and I discuss this obviously all the time, and not just because we're big believers in our products, but we're big believers in people's overall well-being and the understanding of supplementation and a good healthy diet. And I think that aside from some of the we'll get into further with the maths, etc., how do you feel like you've noticed a difference going into these situations? Do you feel better prepared knowing your supplementation, knowing your diet, etc.?
Oh, absolutely, absolutely. We know the people at high risk for things like this. We know that the people, well, not at high risk, but we know the people at highest risk of getting a complication from this. And there are, people who have baseline diabetes, people who have baseline hypertension, people who have baseline obesity. And so whatever you can do to change your diet, change your eating habits, change your insulin sensitivity, whatever you can do by supplementation, by diet to do that, you're improving your overall function and your capability to fight off this kind of infection and fight off this kind of disease. So you definitely want to be focusing on those things for sure.
I think I kind of want to go off on a tangent here just a little bit because I had this in the back of things I want to talk to you about. What about the idea of impacting different people, whether that's ethnicity, demographic, geographic, different people of different backgrounds, etc.? What have you noticed in your, experience being exposed that you would kind of like to preach to others or inform others?
Well, the numbers are still coming out. They're not, the numbers are available by state. What we do know, and this kind of hits close home to me because I'm an African American. And what we've been seeing is that this is definitely impacting the African American community in much more significant ways than it's impacting others. And you can look at communities like down in New Orleans or in Milwaukee or Detroit, where there's a very high population in the urban areas where, the population density. So that's another thing we talk about when we talk about this. We talk about population density and how it affects disease transmission. Because in those urban areas, in those places where people have traditionally been in government housing or just really urban areas, the population density affects how easily the disease can be transmitted. So combine that with historical diets of things like soul food or fried food, and it just puts together a high-risk situation for complications from from COVID, for sure.
Yeah, I think that's really important to take into account some of the things that you and I have stressed about diet, at least for me being a nutritionist, how much I stress diet to my clients on a regular basis. Now more than ever, it's vital to eat a healthy diet, but also to understand where your diet's lacking, how you talk about vitamin D being so important and definitely supplementing with that, antioxidants being so important. Maybe you can touch on just a couple of those really quick while we're on topic of things that you feel are vital, depending, just vital, I guess.
Well, I think it depends on people's diet and how they're handling whatever's going on. Because if you walk into most grocery stores, you're going to find shortages of certain things depending on where you go. You'll find shortages of produce, which is where, and fruits and vegetables, where you get a lot of your natural antioxidants. You're going to find shortages in proteins, and like if you go to the poultry or the meat department, you're going to find shortages there. So it just depends on a lot of it's geographical, and a lot of it's depending on what you can find. I think that I went to the grocery stores last weekend, and they were starting to do like one in, one out. So like there was a line outside of Whole Foods to get in, like a block long. So I said, well, not going to Whole Foods, so I went to another place. There's a line a half block long. So I said, well, not going there. So I just kept going further and further away from, I don't want to say a more bougier places to less bougier places, I guess. That's the best way to say it. And I finally just went to another grocery store, and I was able to get right in. But in that place, there were significant food shortages that I know wouldn't have been there. And so it becomes this thing of convenience versus, exposure. Do I want to be exposed to all these people? And I remember this really closely. I was in Target with my girlfriend a couple weeks ago, and we're in their produce section, and it was really crowded because the produce section is not very big. and it was just really, you were surrounded by people, and I just felt very, very felt very unsafe. And so I was just like, can we get out of here? Can we get out of here? Can we get out of here?
Yeah.
It just didn't feel like the kind of, like anyone was practicing any social distancing significantly at all.
Yeah, I think that's a huge thing to kind of understand too, is like accessibility is vital, obviously, to understanding a healthy diet and getting a well-rounded diet. But I think that that's where the supplementation is, because we're not all getting enough vitamin D. Yes, some people are getting more, but we're not all getting enough antioxidants. We're definitely all not getting enough vitamin C. So if you had to recommend common supplements for someone to take right now, based on things kind of, you know, us exploring different environments, what would be your top products that you would recommend to someone that's going to have more exposure?
Okay, so I recommend that most people take just a general multivitamin for sure. Either a base multivitamin if you're not, or if you're still working out, take a high-level multivitamin. I think everybody should be supplementing with vitamin D, because on this, quarantine or uh, stay-at-home orders, that most people are spending a lot more time indoors than outdoors. And without sun exposure, you can't really get vitamin D. So most people should be getting, probably supplementing with at least another 5,000 IU a day of vitamin D. I also think most people should be on a good probiotic, because as you're staying home, with the food sources are down, or maybe eating a little bit more junk food than you typically would, a good probiotic. A probiotic will be helpful in making sure that your intestinal tract continues to give you additional immune support. So those are three. And then any additional antioxidants you can get. Coenzyme Q10s, ALAs are really, really good products that could just help boost your immune system. Any vitamin C that you can get from anywhere, any zinc if you can get from anywhere, both are extremely impossible to find these days. But those are the ones I'd recommend, definitely.
So for anyone that is just now or is listening, the products that he's talking about are basically our Opal probiotic, our Cell Fuel, and our Optimized Longevity, which is our multivitamin, either one. And I'm missing Focus and Power is the other one, the things that he mentioned. Okay, so there was also another topic that is kind of off, but we wanted to talk a little bit about it. You were really interested in kind of explaining it to people, was the whole situation with masks right now. And I know that that's something really vital for people to fully understand, especially as we start to transition life and kind of knowing what's going on. So let's talk a little bit about that.
All right, so just want to talk a little bit about masks, especially as states are starting to lift these restrictions and people are going to be out more in public. Again, the problem with COVID is that you don't know who has it. And there's a couple of different reasons why. Number one, 20% of people who have it are asymptomatic, so you'll never know they have it. But that doesn't mean they can't transmit it. Another thing that we've been learning out is that about 20 to 25% of people who test negative for COVID who do have symptoms, if you test them again a week later, will have a positive test. So there's a high false positivity that are in the test right now, and so they're really having to work on these tests to make them more accurate. So I see a lot of patients in my office. Everyone who comes to the clinic has to have a mask on. And I guess you guys have seen the memes of people wearing masks all different kinds of ways. And if you wear a mask improperly, you're basically doing yourself a disservice. And so one of the things I wanted to do with our clients, or with the people that are following us, is to make sure that they're doing what's right. And I think we've got a couple masks I can show you how to put your mask on correctly.
Let's do it.
And I'll give you some other tips. So hold on just 1 second.
Okay, perfect.
All right. So I'm back. So most homemade masks, or excuse me, Most regular grade masks are going to look something like this. They're going to be blue on one side or green, and then white on the other side. Most people don't even know that there is a way to wear this. If you have a color on one side and white on the other side, white always goes on the inside. I can't tell you the number of people I see who wear masks backwards, and if you're wearing them backward, there's actually a reflective layer on the colored side that prevents the mask from working correctly. So you're doing yourself a huge disservice if you're not wearing the colored side on the outside. Ladies, number one, don't wear makeup if you're going to wear a mask. I know it sounds crazy, but the makeup will stain the inside of your mask. The powder will come off, and then for the rest of that time, you're inhaling powder. Okay? And you're not designed to inhale your foundation or whatever that stuff is. Otherwise, you wouldn't wear it. So you're not designed to inhale that. So if you're going to wear a mask, don't wear makeup. If you get one of these masks, a lot of these masks will have what feels like a little wire in it. And that wire is there for a purpose. So what you always want to do is take your mask, fold it in half, and make that little bin perfectly flat at the top. And then you can pinch it. Sorry. So you want to make it, again, bend it flat and then pinch it. And so when it pinches, it makes that curvature to fit right across the crease of your nose. And you can press that down and it comes around. Then you want to make sure that you loop over the ear, and then pull the bottom flat to cover your whole face. Now what this allows the air to actually come down and around and behind you. Now, sometimes the mask is too big or too loose for some people. So what you can do is take it, put an extra little fold in it, and put it down one more time. And that'll actually just pull the mask even tighter around your face and get you a better seal. Now that's for these masks. Now some of the homemade masks you'll see, a lot of them won't have that little metal piece in it, and you'll see people with big kind of gaps in the mask there because it's not sealing around, and that's really not helpful too because the droplets can get down if they're really close to someone who's affected. Now, the other mask we talk about is the infamous N95 mask. That's one of these. These masks are made different. These masks are so thick that if someone were to spray perfume in front of your mask, you shouldn't be able to smell it. Okay? If you can, then that means you don't have the mask on right. And so that mask typically has either a foam or a rubber insert on the inside. You want to do kind of the same thing. You want to pinch it around your nose. Like such. Now, the trick to these is most of the time these masks have two cords on it, one at the top and one at the bottom. So the trick is you want to make sure when you put the mask on, the cord at the top is going to the bottom of your neck and the cord at the bottom is going to the top. So they're going to make a kind of a crisscross pattern around your ears. And so ideally what that's going to look like is it's going to look kind of like this, and then you pinch, you get a good seal. So again, the bottom should be pulling that mask up, and the top should be pulling the bottom part of the mask down. That's going to create a perfect seal so that nothing can get through, and someone can come and spray perfume or anything really strong right now, and I wouldn't be able to smell it. Most of the times, in the hospitals, we get fit for these masks because they make different size masks for different size people's faces. So a lot of times if you just if you just went and bought a mask, you want to make sure that the mask actually fits and that you get a good seal. So
on top of that,
it's mask 101.
Yeah, I like it.
From a surgeon who wears them all the time.
So to kind of lead on to that, we were talking about some of our susceptible clients or patients or viewers. What would you say to them would be the ideal mask for them to start wearing, or for them to wear as things start to open up, as they go into public? If they have to go into public, what's in your opinion?
Anything is better than nothing. And so a face covering, at least in these early stages, until we get more testing, and until we can figure out, how weather sensitive the virus is. anything you can put on your face is better. I recommend these kind of less expensive, cheap ones. Make sure you're wearing them in the right direction. If you have the homemade mask, that works too. There's 50 different designs that you can do. But if you do, or if you are wearing a homemade one, make sure that there's a seal above your nose. A good trick that you can do is just take a piece of Scotch tape, put across the top of that, and it'll help seal that top area so that you don't get airflow either coming into your eyes or let airflow down in above your nose into your nasal oral area.
Okay, last question, because I know I've kept you longer than you ever wanted to be kept. But I think that while we start to do the transition, we're still wearing our masks, we're still taking our precautions. How important is it for people to continue supplementation of our antioxidants, of the vitamin C's, of our probiotics? What do you feel like is the important part about that?
I think it's really important. Again, we're going into territory right now that's unknown. We don't know who's positive, who's negative. We don't know who's symptomatic, who's not. We don't know who has allergies or who has something real. But people are going to start being out and about, and people have kind of been itching to get out and about for a while. So in these first couple of weeks, just be careful with who you surround yourself with. Be cautious. Make sure you wear masks, you wear protection, and you continue to build your strength from the inside out by using antioxidants, by using things that are going to boost your immune system, like vitamin C, like probiotics, like those antioxidants, like a general multivitamin or a high performance multivitamin. Do the things that are going to help you build yourself from the inside out as strong as possible.
Yeah, I think that's huge. I think one of the things I've had to stress a couple of times is that, people are getting so excited about getting out in public and going to do all the things that they do, but understanding that opens to so much unknown, just like you said, and it opens us up to all of the things that we've been constantly worried about and the reason why we came home in the first place. So if you weren't supplementing before, now more than ever is the ideal time to either consider supplementation or to really be cautious of your diet, not eat things that you know are ruin your immune system or things that might start to tear you down, and things could cause harm to you instead of actually helping you as you transition back to life.
Yeah, I think it's going to all be about risk mitigation. How much risk are you willing to take while you're putting yourself out there? And what you can do to help mitigate those risks is build your immune system as strong as possible, and take whatever you need to take in order to do that. And I think that the stronger you feel, the more prepared you'll be to venture out into this new unknown world, where everybody's going to be masked, but you don't really know if they're a threat. I don't want to say a threat, but you don't know if they're dangerous to be breathing the same air or not. So just be cautious, be careful, be confident, and be well prepared, well built from the inside.
I love it. Okay, so that's all the questions that I have